What's up, man? It's your girl DJ Charisma. I'm here with Megan and Dr. P. We're here at the Canna Spa, and I love it. It's a couch full of powerful women right here.
Absolutely, absolutely.
All right, you guys, I got a couple questions for you, because I know you're a doctor and you were showing me all kinds of goodies, oils and creams. How can patients better advocate themselves when talking to doctors about cannabis use?
So I'll just get us started, knowing what they're consuming, knowing what they're putting in their body, whether it's the dosage, whether it's, if plant medicine, we're talking about cannabis, strain, knowing about how they're consuming, knowing their intentions, why they're consuming. All of that information, passing that along to their practitioner, to their clinician, that's gonna be important information. So
Be clear.
Be clear. I'll pass that on to Megan.
Yeah. First, I'll just say it's so hard to have that conversation with our doctors because on the forms, it still says, are you using these illicit drugs? And then you have to check the marijuana box, but it's like, but I'm using it for pain or sleep.
Right.
So it's still very hard to have that conversation. So when patients, honesty is fantastic, but also discretion, because with insurance the way it is, there may be something that could come up later that may not be covered because you disclose your cannabis use.
Really?
So it's a tricky thing. It's a fine line. Patients have to use discretion. But I find that doctors are learning most from their patients because they're refusing to do the work themselves to actually learn about the endocannabinoid system and cannabis. So they're learning from patients that, this is working for the pain, and they got them off opiates. They stopped drinking alcohol.
That's why you want to know. That's why you want to be clear.
Exactly.
On things.
Exactly. So, patients we have to teach our doctors. Unfortunately, we shouldn't have to, but
at least in 2026, it's probably gotten a lot more awareness going on.
Right.
Especially back in the
with
90s.
Schedule 3 on the horizon, we're getting there, but we still have so far to go.
So training the doctors, really, that needs to
Train
take more
them
place.
on you.
Train them on
you. You are your own medical history, right?
Facts.
You're not the person that was in the room before you. So let them know who you are. Be clear on who you are.
Okay. All
Absolutely.
right. Okay, I got another question for you.
Sure.
With the mental health challenges, do you most commonly see in creatives and artists of color, do you see a lot of just challenges, mental stress, and how this can help that out?
So, as a person of color, as a therapist treating people of color, I do see a lot of overconsumption and sometimes emotional numbing with consumption of cannabis. And what I find is that people don't understand that a little goes a long way. And the thing is, with our culture, we have used cannabis for
My whole life,
millennium. And we've used it in such a way that we will consume for hours and times, days, and that's just the way that we do it, and it's fine, but a little goes a long way. So when you're using it for your mental health, you don't have to have an entire long session to consume and feel the benefits of the plant. And so overconsumption can sometimes fall into a person finding themselves into a place of depression or finding themselves into and anxiousness and things of that nature, and that doesn't have to come from utilizing the plant. So when I see people that are creatives and utilizing the plant for trying to find creativity and intentionality, I always say a little goes a long way. Pull back.
It's easy to overdo it.
It is. So I always want to entice people to know little goes a long way, slow and steady.
Slow and steady, I like that. It's best to practice that too, because your tolerance becomes super high.
It does. And when you back off a little bit, you understand that
Take
the
a
plant,
break.
it really, it benefits you and it blossoms within you.
I love it. Okay, next question. We can go with Megan on this one. Okay, if someone is plant curious but cautious, what's the first reasonable step they should be taking? If
If they're going to go it
they're
on
newbies.
The newbies, if they're going to go it on their own, of course, the mantra is to start low and go slow. We're starting at a very, very low dose. We're talking like 1 to 2 milligrams, 1 to 2 puffs, and then not doing any until like the next day, so we can know how that affects us. But for those who have specific medical conditions that they're coming to cannabis for, then of course coming to a medical professional, the therapist or somebody that can help guide them on which cannabinoid, because there's 100 of them that come from the plant. Which terpene profile is going to be the best, because there are terpenes that help with inflammation and more that are uplifting and sedating. So working with a professional who knows about the plant and how it interacts with specific systems in our body, that's where newbies can benefit from working with someone.
Yeah, it's me. I'm usually a flower type smoker, but when it comes to all the oils and all that, I don't even. There's so much to learn about it.
So much, and there's so much we don't even know.
So much we don't know, and things are being put on the shelves that even the bud tenders, and those are the people who work in the space, don't even know. They have to get trained on in the space at the time. So you're coming in and you're asking questions of people who are learning in real time, so we have to be so careful. So there's research. That's why we do need the rescheduling of cannabis, so we can get research, so we can have information and get that education out there. Absolutely.
What are some of like the best sites that you as a doctor know that people should go if they want to know things like that?
Well, I do like Leafly, and I always say it wrong. Is it Leafly? Because is it Leafly? Okay, because it's Leafly. I do like Leafly, but I'm a researcher, so I'm going on like PubMed. I'm looking at things like that. But there's text. Cannabis is Medicine is a text. There's another text that once this is edited, hopefully we could put some links up there and things like that. Put some look at that down there and check those things out. But there's definitely books out there that are coming out that information is reliable and available to us.
Okay.
Yeah, I'll put healer.com is a
Healer.com?
fantastic
Okay.
Dr. Sulak. That's a fantastic research.
Cannaheals.org is a very good website that I publish, and I put my research out, and it also has blogs and information from other researchers as well. Cannaheals.org.
Right. I know my father, he had gotten cancer, and he was really looking into the natural way to heal yourself, so and those were a lot of topics that came up to us, but we didn't know where to look.
That's right.
So those are super important for cancer patients as well, and all kinds.
Absolutely.
Do you have any more sites you want to share?
But I mean, like at Enthea Care on all the socials, I put out educational content almost daily.
Okay.
So
Okay.
And we're both beating our feet to try to get that information out there, whether it's on Instagram or LinkedIn or coming to events like this.
Yeah, this is a vibe too, you guys. Like, you guys are, if you get to come to the next one, please do come. What is like one of the biggest stigmas around cannabis and using it for healing purposes?
You're gonna be on the couch. You're gonna be on the couch. You're gonna be on the couch. You're not gonna be able to do anything, and it's not for healing. That's what I hear. It's just not for healing, and that's just not the case. I have so many clients that I see function and do well, and have fully functioning lives, and have done the work in therapy with the plant as the basis of that work. And I find that it is so incredible when I hear that people don't give it a chance, and so that stigma, we have got to come from behind what prohibition taught us.
What the DARE program taught us.
Yes.
Shout out to DARE.
Come on, the war on drugs. Come on.
Yeah. One of the biggest stigmas I see is that THC is the only part of the plant.
That part.
So there are so many other parts of the plant. People don't have to get high to heal. And we see this hyperfixation on THC potency and THC content, and with the the vape pens and the concentrates, and we see people get really sick after long-term use. I'm a CHS researcher, so I study cannabis hyperemesis syndrome, and it's very real, and it comes from heavy use. So I think that there's this huge stigma that you have to use heavily in order to be able to heal, and that is not true. We
such
have
a great plant.
Such a great plant, and CBG. CBG is so fantastic. It can do many of the things that THC can do, but without the drowsiness, without the high, without the euphoria, but like with improved focus using CBG. So.
I actually, am a proponent as someone who needs to consume cannabis in order to treat a condition that I have, but cannot have THC in my system for the work that I do.
Oh yeah.
I need to find cannabinoids that keep me away from that the psychoactivity, because I need to keep myself away from that. And so I have to find the other parts of the plant. So we need to stick and learn more and stick away from those stigmas.
Yes, 100%. Plus you can make yourself a cool hemp outfit.
Right.
The plant is make a rope. We can do all kinds of stuff with it.
Yeah.
Well, Megan, Dr. P, thank you guys so much for just teaching me some stuff. I really appreciate it. Yeah. Like we said, we're gonna drop the links down below. You can check out their websites.
Absolutely.
And I love what you guys are doing, man. Thank you so much.
Yeah, I really appreciate it. Canna Spa Wellness
Canna
Lounge.
Spa.
Yes. Shout out.
Shout out to you ladies.
So full of gratitude to be here.
Yeah, thank you.
All right, y'all, we out, man. Let's go. Canna Spa.